Okay, so while you guys are doing that, we're gonna go over just the first basic stuff. So the weight capacities are listed on the machine. So the top unit is 600 pounds. The bar is 800 pounds. And then on each of the lifts, they have the weight listed on the tag. You go by the lowest weight. So on the medium sheet, which is the one we'll use most frequently with our clients, this is 440 pounds. So all three together, you can only lift someone who's 440 pounds because you'll go by the lowest weight restriction. I know this is the medium sheet because of the yellow stripe. Yellow means medium. So then the weight limit is listed right here on the tag. This sheet and this one are the same thing, except this one is disposable. So this one we use more so like with clients that have like infection control precautions, so that we can just toss it when they're done with them. This one can be laundered.
Is that the same weight?
The same weight, yep. The large one is blue, so it's got the blue stripe. So that's how you'll have the quick references. And I did go look, and in the equipment room across the hall, there was a spot labeled for lift sheets. So my best guess is these will be stored across the hall. We'll go over those two here in a little bit. So this red cord is the emergency stop. So if something's going wrong while you're lifting, you can pull this and it'll stop. It won't let you lift it up and down when this is pulled. I know it's pulled when you can see the red out there. So if you have someone that's very tall and can push it back in, they can just push it with their finger, because now I'm trying to pump it and it won't come out because it's emergency stop, so nothing works. The lady, this is how she got it back in, is you just gently touch it. And now it's back in, so now it's ready to use again. So if we're going to use the Hoyer lift here, patients typically are like non-weight bearing, total assist, or max assist of 2 to 3. The goal of this is just to take some of the stress off the staff while they're using it. Okay, so this is where I'll name my volunteer, because now we're going to be on number 5. The volunteer, come and have a seat in the bed. So I'm going to show you how to get this on with minimal shearing as possible. So I'll have one more staff present on the other side.
Jumping down?
Yep. And if you were ever a CNA, this is probably a review for you. So what we'll have them do is you're going to roll that way. Now the outside has the stripe. And if it's the disposable one, it's got all the threading on the back. That's how you'll know. But you're going to lay that on her and try and line the stripe up with the spine as much as you can. And then you're going to kind of fold this and tuck it and go ahead and roll back. Okay, keep rolling. So now when she pulls this out, you'll see it's going to pull against the bed, not her. So that's how you protect the skin. Okay? Then we straighten out the straps here. So for somebody that maybe didn't have very good neck control, you'd want to make sure this is up a little bit higher to support the head there. And then we're going to lower this here. So it's just a simple up, down. Those are the only 2 buttons.
This is super scary because this looks so flimsy.
Yeah, and it should be straight at all times. You can twist it, but then you notice like this starts to twist a little bit, but this rotates. So the way to remember the right way is, here, the widest bar should be on their shoulders. So think of like wide, broad shoulders. So you would hook this up by lifting these up. So we'll go ahead and do that. Got those? Okay. These straps down here, what you're going to do is you're going to put them through her leg. Okay. And then you're going to thread them. And these do have different colored straps, so you want to make sure you're doing the same one. So let's do dark green. Okay. And before we lift her too, So this whole unit is plugged into our electrical system, so it's always charging. For some reason, if we have a power outage or the generator or something isn't working, this indicates the battery life. And obviously all the dots are lit up, so it's fully charged. Okay, so we're gonna lift you up. We tell them to keep your hands across your chest.
This is weird.
Have you been in one before?
No.
No? Okay, so you lift them up just high enough where they clear the bed. You don't want to go any higher than that. So then I'm going to clip this back on here so I don't bonk her in the head. And actually you can move it if you want, but it's so light, it's one-handed to move her. So we can go up and down these tracks, and then we can also pull her over to the side.
So awesome.
How fast can you push me?
I'm fast. It does not go in the bathroom. So if somebody needs to use the restroom, we put a commode right here. Or you can put the chair right next to the bed. But when you're putting them in the chair, you're going to want to kind of pull up a little bit so she sits up nice and high. Do you want to go in the chair?
Yeah, I don't care.
You do? Okay. I can show you guys that one. So Sam, how do you come over here?
You mean Brooke?
Brooke,
I
sorry.
have to be called Sam often.
So you'd have two people helping. There's a strap down here, pretty low. You see that? If you have my hand down here.
Oh.
So you just kind of lift her up. Yep. So you'll lift her.
With that one?
Yeah. Put the one on the side too. Just so she sits up nice and tall. And then you want to make sure, obviously, the chair is locked when she's going down.
A little crooked.
So gentle.
It's gentle, good. So this does go all the way to the floor too. So let's say you find somebody on the floor, you can put this all the way down to get them off.
Is this in every room?
No,
No.
I believe it's 4.
The
Yep.
IC rooms?
2 in ICU and then 2 is med surge. Yeah.
Okay.
So then to get them out, lift the straps up. And I can let you lift it up now if you want. So typically just have one person do the control, one to make sure the bar stays away from them so they don't get hit. Okay, so that's the multi-strap one. So the disposable one is the exact same, but it looks a little different. So this is the back of the disposable one, so that's how you know what side to go up. And the disposable one only has 1 strap for the legs, where the multi-use one has 2 straps depending on what you want. Okay, the next one I'm going to show you is, and I'll have you volunteer again if that's cool. So I'll have you lay in the bed. This, let me get the right name for it, is called the Solo Multi-Strap. This could be used for a couple different things, but if you have like nursing who's doing like foot care, what you can do, so instead of having your patient like having to hold their foot up the whole time, you can put this around them, have it lifted, and then it holds their leg up for them. So that way, you know, you can pull up a chair, do your cares, try and be as ergonomic as possible. And then they can kind of just relax. So Brooke, I'm gonna have you help me with this one too. This, if you have 2 of these, can also be used for repositioning. So what I'll have you do is roll that way. And you tuck it, okay, roll back towards me. Pull it out. Okay, now roll to your back.
And this requires 2 people?
Yes. Yep. So let's say like you're having to do like bedding change or like wound care or anything like that where they have to be kind of on their side for a little bit. You have 2 of these straps and I only have 1 right now, but you turn the bar sideways and Brooke, you're just gonna hold yours. So she's just gonna hold it so it doesn't slide out from under her. And you can lift it. So normally I'd have 1 more down here so this wouldn't be so crazy. And it's gonna turn her over. And she holds that way. So this way you can do your cares here. The bed also has this function to do sideline. This is nice too as an added feature, but it kind of gives you a little bit more control. So let's say you have somebody who maybe had like poor neck control, a back injury or something. You're good there. You can also use this one instead. And this just does the full body. So we'll take this guy out. That just had to sit up. I think it goes her whole foot. Okay, roll back towards me, watch your head. Okay. So for this one, again, you turn it to its side. This has 6 straps, so you do 3 and 3. And then you can rotate her that way too. This provides just like a little bit more control. This one can also be used if somebody's found on the floor in the bathroom. You can use it to drag them out and then hook them up to this. It gives you a little bit more control. This one also helps with moving them to and from stretchers. Like if you have an ambulance stretcher and they're brought into a room, you can use this because it keeps them nice and straight, versus this one puts them up into a seated position. All right, let's lift this up so you can jump up here. There, go through our list. All right. So we did the side to side. We demonstrated how to get in the chair. So you could do from the floor, whether seated or supine with this one. You could do that one if they can get to a seated position. Sling removal and adding it. We showed that to do minimal shearing. We don't have a charger, so number 14 talks about returning it to its charging station because it's plugged into the wall. It uses our electricity for that. So I would just hang it here when you're done with it. That way it's not dangling around. Try and keep hands on them whenever they're doing side to side or the transfer, just to increase patient safety. Number 16, the lift pants and master vest. We do not have those. It's talked about maybe in the future, but with the lift pants, it's essentially pants that they can wear so that you can have them in standing while wearing this. And that way they could practice walking, while on the track, that type of thing. We have this with a stretcher, but we don't have the stretcher in here, so we're not going to do the transfer side to side. Patient indications would be if they needed total or max assist, just to take some stress off the nurse or staff, and then also to increase the patient safety. And then we talked about the different loops. Okay, that's it for education.